Hello, my name is Dr. Dewan S.Raja. Today I will discuss about Becker's cyst, also called popliteal cyst. A Becker's cyst is also known as a popliteal cyst, is a fluid-filled swelling that develops at the back of the knee. This fluid is usually a synovial fluid, like that of the synovial fluid present inside the synovial joint like knee joint. It is first described by Dr. Adam. He was an Irish physician, and then illustrated by Dr. Becker. Location: it is typically forms behind the knee joint in the popliteal fossa. Cause: the cyst is usually caused by excess joint fluid, synovial fluid, that bulges out from the knee joint capsule through popliteal fossa. It may be associated with history of trauma, especially in children, rheumatoid arthritis, osteoarthritis, meniscal tear. These are mostly seen in the adult. It may also be associated with patellofemoral chondromalacia, maldevelopment of the patellar cartilage, and also the associated articular cartilage and the bone. Fracture, gout, pseudogout, deep vein thrombosis, and infection like tuberculosis of the knee joint. Okay, so this is the image taken from a website. This is the credit of that website, Google image. This is the normal healthy knee synovial cavity. This is the synovial cavity containing synovial fluid. Becker's cyst, a flow of synovial fluid from the knee joint, this is the knee joint, to the gastrocnemiosemi-membranosus bursa. This is one of the theory, or just protrusion posteriorly due to excessive collection of fluid. It may protrude posteriorly, or it may be communicated with the bursa between the gastrocnemius, left head of gastrocnemius, and the semimembranosus. There is a bursa there, so there may be communication between the knee joint capsular fluid and the bursa between the gastrocnemius medial head and the semimembranosus tendon. Becker's cyst symptom. Becker's cyst may cause no symptom at all if it is small and can be discovered incidentally during a physical exam. However, when symptoms do occur, they include swelling behind the knee in the popliteal fossa, because the popliteal fossa is located behind the knee. Pain in the popliteal fossa, leg edema. This may happen due to blockage to the venous return, decreased range of motion of the knee, stiffness, knee locking condition. Foucher sign: the cyst become hard with knee extension and soft with knee flexion. That is Foucher's sign. Differential diagnosis: deep vein thrombosis, popliteal aneurysm. Popliteal vessel in the popliteal fossa may have abnormal dilation. Popliteal abscess due to aneurysm, and it may be any bacteria, that may lead to popliteal abscess. Tumor, any type of tumor, may be benign like that of the lipoma, because a lot of fatty tissue is present there. There may be osteoma, there may be chondroma. Tumor. Varicosity, the vein may be abnormally dilated and maybe partially blocked, that is varicosity, and its course is very much zigzag. Okay, ganglion, again extension of the synovial fluid. This is that ganglion. So they all forms the differential diagnosis. But how can I diagnose? Diagnosis is typically based on physical exam. There is a clinical examination, an imaging study like plain X-ray. We may get some type of calcification in the cyst, ultrasound or MRI, which can confirm the presence of cyst and assess any underlying knee joint issues like the osteoarthritis or rheumatoid arthritis or gout, pseudo gout, or any type of melasma. Okay, this is the MRI of Becker cyst or popliteal cyst. So this is the transverse section. Okay, and this is the cyst here. Cyst is located here. Okay, we got the cyst here, the Becker cyst. Here again, axial, here is the T2 here. Okay, sagittal section here. Okay, and here is the popliteal cyst. Again, this is another sagittal section, MRI section, most likely T1, and this is the popliteal cyst, and this is the popliteal cyst. Cyst by definition means a cavity containing fluid is called cyst. Treatment depends on the size of the cyst and whether it is causing symptom. Options include conservative measures such as rest, ice, elevation, and non-steroidal anti-inflammatory drug like ibuprofen. Treating any underlying knee joint condition like rheumatoid arthritis, osteoarthritis can also help. In some cases, aspiration, draining of the cyst fluid, or corticosteroid injection may be considered. Surgery may be required on rare occasion to remove cyst by arthroscopic or open cystectomy. Prognosis: most Becker cysts resolve on their own or with conservative treatment. However, in some cases, they may recur or persist, especially if the underlying knee condition is not adequately managed. Complications of Becker cyst include rupture because it is a collection of fluid. So it may be ruptured. By definition, cyst means cavity containing fluid that may rupture. There may be deep vein thrombosis, or this deep vein thrombosis may be associated with Becker cyst. Nerve impingement, yes, with the nerve like that of the sciatic nerve, continuation, the tibial nerve, the common fibular nerve. Okay, so the tibial nerve may be compressed here and we may have tingling numbness along the distribution of the tibial nerve. And that's all about the Becker cyst, also called popliteal cyst. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel and please subscribe me. Have a nice, wonderful and blessed day. Bye now.